If you've been on Zepbound for a while and noticed your weight loss slowing down, you might be wondering if the medication has stopped working. It's a really common concern, and today we're going to break down what's actually happening. Here's the good news right up front. Zepbound doesn't actually stop working over time. Clinical trials show sustained effectiveness beyond 72 weeks. What you're likely experiencing is something called metabolic adaptation, which is a completely normal part of the weight loss process, not the medication failing you. Individual results do vary, and your healthcare professional can assess whether your current treatment plan is working for you. Let's talk about how Zepbound works. Tirzepatide is what's called a dual receptor agonist, meaning it activates two different pathways in your body simultaneously. The GLP-1 component slows down how quickly your stomach empties and increases feelings of fullness. You might notice you feel satisfied earlier during meals or have fewer cravings between meals. The GIP component appears to enhance insulin sensitivity and may influence how your body handles fat and energy, though researchers are still learning more about these mechanisms. Together, these actions help reduce your overall caloric intake while potentially improving other metabolic markers. This is a once-weekly prescription medicine taken exactly as directed by your healthcare professional. Now, let's dive into those frustrating plateaus. When weight loss slows or seems to stop, it's usually not because Zepbound has stopped working. It's because your body is adapting to your reduced body mass. As you lose weight, your body requires fewer calories to function, and your metabolism adjusts to your new weight. This is a normal physiological response, not drug tolerance. The SURMOUNT-4 trial really demonstrated this well. Patients who continued taking tirzepatide maintained their weight loss, while those who switched to placebo experienced significant weight regain. This shows the medication continues to work even after substantial time on treatment. Here's something really important to understand about obesity treatment. It requires long-term medication management. If you stop taking Zepbound, weight regain typically occurs regardless of how long you've been on treatment. This isn't a failure on your part. It reflects the chronic nature of obesity as a medical condition. So, what can you do if you feel like Zepbound seems less effective? First and most importantly, have a conversation with your healthcare provider. They may adjust your prescription if appropriate for you, based on your individual response and how well you're tolerating the medication. Do not change your medication dose, schedule, or stop treatment without your prescriber's guidance. It's also worth reassessing your lifestyle modifications with your doctor. Are you still maintaining the reduced calorie diet you started with? Has your physical activity level changed? Sometimes small shifts in these areas happen gradually without us noticing, and your healthcare provider can help you identify where adjustments might help. Keep in mind that some people shouldn't take Zepbound at all. If you have a personal or family history of medullary, thyroid carcinoma, or multiple endocrine neoplasia syndrome type 2, this medication is contraindicated. Always discuss your complete medical history with your healthcare provider. When should you reach out to your doctor? If you experience significant side effects, if you're concerned about your response to treatment, or if you're considering stopping the medication, don't make changes to your treatment plan without medical guidance. Let's recap the key takeaways. Zepbound continues working long-term, with clinical evidence showing sustained effectiveness beyond 72 weeks. Weight plateaus are usually metabolic adaptation, not medication failure. And working with your healthcare provider to optimize your treatment plan and reassess lifestyle factors can help address concerns about effectiveness. Remember, this information is for educational purposes only and shouldn't replace personalized medical advice. Always consult your healthcare professional about your specific situation and treatment plan. They're the ones who can provide guidance tailored to your individual needs. Have you experienced a plateau on your weight loss journey? Drop a comment below about what helped you push through. And if you found this helpful, hit that like button and subscribe for more evidence-based health information from Fella Health.